started here. Thank you guys for being so prompt, and we've got our Sage of Central North Carolina folks here, Sharon Kilpatrick.
Good morning.
Good morning. All right. So welcome everybody. Good morning and happy Tuesday. I'm Heather Burkhart with the North Carolina Coalition on Aging. It's wonderful to see so many of you here. We had great registration numbers, so we may have more people coming in. And Madeline, I will ask you to admit them real quick if I don't see somebody. I made you co-host. This is Madeline Rickett, the intern we have at the Coalition on Aging this session, and she is our our technology guru who helps me with so many things. So anyway, we're glad to have you, Madeline, and we are glad to see all of you. For those of you who don't know about the Coalition on Aging, we are a nonprofit organization made of a diverse coalition of groups and associations as well as individuals who are all working together to give voice to older adults and older adult issues, all for the purpose to improve quality of life. And we do that through education, like events today, collective advocacy, and policy work. So if you're not familiar with the Coalition on Aging, I invite you to go to our website at nccoalitiononaging.org. You can learn more about us. You can go to members and see who our members are, and even join. But do know the Coalition is here to give voice to older adults and to bring forth important topics that impact them. This event today is sponsored by our Health Equity Workgroup as well as Sage of Central North Carolina. Sage of Central North Carolina is a member of the Coalition, and they are providing this training as part of our larger effort on inclusion and equity. And so thank you for being here, and thank you for your interest in inclusion and equity on older adults issues. We are so happy to bring this session of creating inclusive services to LGBTQ plus older adults for you. We are recording the event, and I can send it as well as other information that gets shared today. We'll be using the chats. We'll be doing some breakouts and polls, so it will be a great event. We are pleased that Sharon Kilpatrick is here today as one of our facilitators. Sharon is a geriatric care manager. She has nearly 30 years in the field of healthcare and gerontology. She served as the director of a county aging program and has spent more than 7 years working on senior and clinical services. She is experienced as a clinical professional, and she is certainly a compassionate advocate for older adults. Also, who you can't see because they're sharing a screen, is Joseph Wheeler. So they are both in the same room using the same video camera. So later you'll see Joseph Wheeler. He is the president of Performance 421 in Raleigh. He has directed successful consulting for almost 30 years. He specializes in organizational development, group facilitation, and training. And so both Sharon and Joseph have been with Sage of what started out as Sage of Raleigh and is now Sage of Central North Carolina, which has a regional focus. And we are so pleased to have you both here. But Sharon, I'm going to turn it over to you so we can go ahead and get started. Thank you.
Thank you. Good morning. We're very excited to be here today. And as Heather mentioned, we are together. So you're going to see some fast chair moving as we share this presentation today. And just to set expectations, as Heather said, we are going to do some breakout sessions in a little while. And we also will be taking a 5-minute break about halfway through because we think that 2 hours sitting watching a screen is a long time. So just to set those expectations for you, you will have a little break about halfway through. We are very, very excited to be here, and we are going to start sharing our screen now because we do have some slides that we would like you to be able to see. And I don't generally read presentations, so I'm going to talk about some of the things. But we are very pleased to be here. We have a long relationship with Heather and the coalition, and we are just very excited to be here this morning. So just a little bit about what SAGE is. As Heather said, we started out as SAGE Raleigh, and now as of about 2 years ago, are SAGE Central North Carolina. SAGE is based in Raleigh currently, but we have a footprint over to the Triad. We're getting very active in Greensboro and the Burlington area. And we are very excited about programming and advocacy work that we are doing. We are an affiliate of SAGE USA, which is based in New York City. And there are 2 affiliates of SAGE USA in North Carolina. The other affiliate is located down in Wilmington, and they have been doing a lot of work as well. And we work and coordinate with them very closely. SAGE really is emphasizing, and you will see in our presentation today, that a lot of our materials have been work that SAGE USA and AARP have done with surveys and health and education information for LGBTQ adults. So we are very proud to be offering this education component, and this is something that is part of our mission. And we work very hard on providing education and advocacy issues. So today we like to set expectations. We have some goals and objectives. We're going to go over briefly some terms. It is not an totally inclusive list of terms, and we will be providing some handouts, and Heather will be sending those out later for folks that have questions. If at some point you do have questions about terms that we have used or you see on the screen, you're welcome to ask those in the chat, and we will identify or clarify those. Joe is going to be doing a history, because we do feel that our history is very important in understanding service to older adults. And then we are going to do some breakout sessions around some of the statistics, so that we can get you all to do some thinking about some things. And then towards the end, we are going to be talking about what individuals, allies, and organizations can do to be more inclusive and supportive of our LGBTQ older adults. And then we are definitely allowing time for questions, so that we can address anything that we may not have addressed in the presentation. Our objectives are to explore the shared history of LGBTQ+ seniors. A lot of our history is very similar to other older adults, but there are some very unique qualifiers, and we want you to understand how that impacts service, and how we in the community seek services, and how those services can be provided to us. And we want to leave you today with some ways to identify inclusion of older adults, because there are some unique pieces of that. So we really want to have some takeaways for you today of how you can do that. So as I said, I'm not going to go into deep dive on terminology. There are pages and pages of definitions. So some terms that we would like to talk about today is heterosexism is attraction to the opposite sex. Homosexuality, attraction to the same sex. Homophobia, I think we have heard a lot about, is the prejudice against gay people. And homophobia is a fear of or discrimination against individuals. And heterosexism is the attraction of the opposite sex. Preferred terms is LGBTQ. As you know, we have a lot of centers around Chapel Hill. Center has LGBTQ plus, 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 plus. Any of these terms are fine. We just want to acknowledge that there are a lot of different terms that are used. Lesbian, gay, bisexual, transgender, queer, plus may be terms that you hear. And ally is a term for folks that are active in the community, but may not identify in any of the above categories. Gender identity. And these are kind of important terms for us. The gender identity is one's true sense of self, related to an understanding of feeling about whether one is emotionally, psychologically, or spiritually a woman or a man, or both, or neither, regardless of one's assigned sex at birth. Gender expression is the way a person expresses their gender through behavior, appearance, gestures, movement, clothing, and grooming, regardless of whether or not these conform to one's current gender. And we hear a lot about those, so that is why I wanted to emphasize those terms. Preferred terms, and you will notice that Joe and I have our pronouns up. That is one thing that we will be talking about during the presentation is a signal to folks to talk about pronouns. So cisgender is a person whose gender identity aligns with the assigned sex at birth, a person who is not transgender. Transgender or trans is an umbrella term used to describe people whose gender identity or gender expression and a true sense of self does not align with their sex assigned at birth. Individuals who have already transitioned from one gender to another may no longer identify as transgender and may only use the chosen gender, example, woman or man. Non-binary, they don't identify in any gender, and non-binary or may be gender fluid. And queer is a term that you may hear. Some folks, and especially some older adults, may have issues with this. It's an umbrella term used to describe individuals whose gender or sexual orientation or identity are fluid or don't fit into the certain label or category. Queer, like many other terms used, may be considered derogatory by some older LGBTQ adults. We hear this term a lot, and I think in general, a lot of our community is getting more comfortable with it, but we just need to recognize that that is a term that may be offensive to some older adults. Okay, at this point, you're going to finally get to see Joe Wheeler, and I'm going to turn over the history to him.
Good morning, everybody. It's great to be here. I've been sitting over here in the wings just waiting for this opportunity. What I'm going to do is take us on a ride. And I'll tell you some of the premises that I start with whenever I do work around inclusion. One is that our institutions and our culture and our society is often set up where there is a dominant group and subordinated groups. And the subordinated groups often know a whole lot about the dominant group's history. As a matter of fact, they may align with the dominant group's history. My experience also is that members of the dominant group often don't understand the shared experience of people who are members of subordinated groups. An example that I think of is if you see two Black guys walking down the street and they cross paths, you'll often see a head nod. That head nod to me designates we share some experience that we may not share with the other people in the environment. I would say that that is also true of LGBTQ folks. We have some shared experience that often has not been part of the experience of people who are heterosexual. I come from a place of understanding dominant group, subordinated group. And here's what I know, that in areas where I experience privilege, where I'm a member of the dominant group, if I operate on default, if I just go through my life, I will miss some opportunities to understand other people's experience. And so what that leads me to is that when we're doing a program, and I presume that a lot of the folks who are with us are cisgender and heterosexual, some of this may be new information for you as we talk about the history, the shared experience of some of us who are LGBTQ. Often, we also hear things like the LGBT or the LGBTQ community. I don't hold that we are a community. I sometimes have more in common with cisgender colleagues than I might with a Black transgender woman who comes from a city environment. I think we are an LGBTQ plus communities. So I also come with that perspective. So let's talk a little bit about what has been some of our experience. So when we were young, we heard words like queer, and we somehow knew that was bad. We realized that we were looking at the wrong pages when we got the Sears and Roebuck's undergarment catalog. If we went to the library and we snuck a peek in a book that talked about homosexuality, what we would generally find is that we were mentally ill. And as many young people, we began to understand our sexual orientation, and we knew that we were somehow outside the norm, and again, that was not a good thing. We knew that we were somehow considered less than our heterosexual peers. And sometimes we talk about homophobia, the dislike, the disapproval of LGBTQ plus folks, but I think heterosexism, which is valuing heterosexuality and things related to heterosexuality more than LGBTQ concerns, issues, feelings, etc., that heterosexism is such a part of our society that that can even be more pervasive than homophobia. And we heard words that described us: queer, faggot, pansy, bull dyke, tranny, and on and on and on. The only word that we had to describe our heterosexual associates was straight. Now, we knew that there were a number of consequences if we were found to be LGBTQ. We could be fired from our job, we could be denied public housing, housing accommodations. And the thing that a lot of folks don't consider is that's still true in roughly half of the states in the United States. The Equality Act, which would provide full civil rights protections for LGBTQ folks, has been passed by the House, and it is now in the Senate and has not been brought to the floor yet. So we got information. We were told that we couldn't participate in our religions. We shouldn't be at the pulpit. We could only participate in certain limited ways, and that was supposed to be a good thing. We were told we couldn't be good patriots, so we couldn't join the armed services or we'd be thrown out. And that the reason we were not there is because our presence was disruptive to our to morale. Now, I want to say a couple things about that history. In 1973, the American Psychological Association, based on current research at that time, determined that being gay should no longer be considered a sociopathic personality disorder. I want to make a point. I'm 70 years old. I was 22 years old when the American Psychological Association determined that I did not have a sociopathic personality disorder. Okay, I might have other things going on, but that was not one of them. That probably didn't change therapists' viewpoint a lot, because there were still various kinds of therapies that told us that we were wrong and bad and we could work through it, we could get better and we could be healed, etc. Now, if you are transgender, the American Psychological Association continues to assign a diagnosis of gender dysphoria. And in some cases, that's important for people to be able to receive services, including medical support, but it can also reinforce the stigma of being transgender. Now, back in what I think of as the old days, our primary outlet was gay bars. Bars that were often down alleyways without a sign, a lot of cigarettes, a lot of drinking, and that's where we had to come together with other LGBTQ folks. And we were in danger of having our being there and having them rousted by the police. You probably heard about the Stonewall Rebellion in 1969. That was an example of a bar in Greenwich Village being rousted, and the folks in the bar resisted that night in a big way, and it set off 3 days of demonstrations in that area. I also want to say that while the Stonewall Rebellion is considered one of our iconic events, there were a number of resistances, particularly on the West Coast, that happened before then. I've talked to folks who lived in New York City back in the 50s, and they said it was a given that if you went out to the bars with any regularity, at some point, the police would come, they would pull you out on the street, they would take information from your license, they would threaten to tell your boss, your employment, and that people knew that they were in danger of losing their jobs. So that's how folks lived back in the 50s, and often just took that for granted. Okay, we had some movies where we had role models. Here were the kinds of movies that LGBTQ folks had as role models. The Detective, that featured Frank Sinatra and Lee Remick, where a gay and bisexual man commits a murder and then it's suicide. Or then we had The Sergeant with Rod Steiger, who commits suicide. Or we had The Children's Hour with Audrey Hepburn and Shirley MacLaine, which ends in a funeral. I sometimes joke that The Boys in the Band, which I think was about 1968, it was based on a stage play, it became a movie, it may have been 1969, that was a groundbreaking film, because in that movie, we didn't kill anybody, we didn't kill ourselves, we only went on to live unhappy, desolate, gloomy lives. And so the role models we had told us, reinforced that we were somehow wrong. Now, in the 1950s, Christine Jorgensen made international headlines when she transitioned to being female. And other than that, transsexual and transgender people were largely invisible. So I want to talk briefly about the laws that we lived under. In 1986, Bowers versus Hardwick, which was decided by the Supreme Court, United States Supreme Court, said that, in fact, we could be arrested for having sex in our own homes because that should be illegal. And it wasn't until 2003, so we're talking approximately 21 years ago, in Lawrence versus Texas, when it was decided by the Supreme Court that we had protection in the privacy of our own home. And here's one of the things that I think about when I think of any kind of diversity issues in our society. If you have never had your basic civil rights determined by a court decision, that is a privilege that you enjoy. And so think about the various kinds of expressions of diversity where the Supreme Court actually has had to rule, yes, you have access to basic civil rights. And this was reinforced in all areas of our lives. And we were restricted from having the benefits of marriage. And a couple key rulings The US versus Windsor in 2013. In 2013, it was decided that we could not be restricted from having the benefits of the federal government for married people. And there were something like, I don't know, 1,100 or 1,400 different financial benefits that were available for people who could be legally married. In some cases, in some states, we could be legally married. It became the law of the land in 2015, Obergefell versus Hodges. And that's when marriage equality became legal in all states of the United States. In 2014, because of a court ruling, marriage became legal in North Carolina. My husband and I got married in October of 2014. His birthday is October 21st. I said, let's get married on your birthday because that's the only way you will ever remember our anniversary. And in fact, we didn't get married that day. We got married on the 22nd of October because one of our witnesses had a Pilates class on the 21st. Go figure. So marriage became legal and we achieved many of those benefits. Some of the things that we know from our history, you may remember Harvey Milk, councilperson in San Francisco, was assassinated by Dan White, and Mayor Moscone was also assassinated. And while he didn't get completely off, I think he was charged with manslaughter instead of murder. And his defense was that he ate too many Twinkies that day and was on a sugar high. And that was that resulted in the hearing for Dan White. Matthew Shepard was murdered, and many people remember that experience in 1998. It's interesting because I've talked with other, particularly gay men, about what that meant to them. Because for me, the death of Matthew Shepard did not have a great impact because I knew of other LGBTQ folks who had been beaten, who had been killed, who had been hurt in many different ways. And for me, Matthew Shepard was just another person. But I recently was talking to another gay man and he said, no, that was big for me because it reinforced that I wasn't safe either. If Matthew Shepard could be murdered the way he was, then my friend said, I knew I wasn't safe in my environment either. So I want to talk a little bit about one of the coalescing aspects of what I think of as our LGBTQ plus cultures. And that is that in 1992, the CDC first used the term AIDS. We began to realize in 1991 that there was an epidemic underway. At that time, it was called GRID, Gay-Related Immune Deficiency Syndrome. What happened is for many of us, and I was living in Columbus, Ohio at the time, as we saw our friends getting sick, we saw our friends dying. At that time, if you lived 24 months after diagnosis, you were considered a long-term survivor. And what we saw was that the federal government wasn't moving fast enough with possible medical responses. And so you began to see a lot of street activism with groups like ACT UP. But even more than that, we began to come together in our communities to take care of our own because we didn't see that the larger society, our government in particular, and the president at that time for a long time even refused to use the word AIDS in public, that we came together to take care of our own. One of the important aspects for me in that was that for many of the women who are lesbian or bisexual, there was not a strong connection to gay men, in part because of gender inequities that were visible to at least some of us. But at that time, many of the women stepped forward to take care of their male colleagues. And in a great way, we saw our communities begin to come together. I have to talk a little bit about don't ask, don't tell. So we knew that anybody who was found out to be LGBTQ in the military could be dishonorably discharged. So President Clinton signed in what was supposed to be a compromise to help us called Don't Ask, Don't Tell. You couldn't ask people about their sexual orientation, though we know that happened in a number of ways. And actually, more people were discharged from the military after Don't Ask, Don't Tell than before Don't Ask, Don't Tell. At least, I mean, more per year were discharged from the military. And so another way we were told, you can't be a good patriot, you don't fit in the military. So don't ask, don't tell. Excuse me, the Defense Against Marriage Act, DOMA, in 1996 was determined that marriage could only happen between a man and a woman. So the federal government determined that no one other than one man and one woman constituted a legal marriage. And it wasn't until the Supreme Court cases in 2013 and 2015 that was turned around. So that has been a good part of our shared experience. What I'm going to ask you to think about is, and what significance might that have to you as you age, if that had been your life experience? And so we're going to be talking about that a little bit more, to think about if this was my background, if this was my context, and now I'm going into a senior center, now I'm going into an independent living facility, now I'm putting my wife or my husband into a memory care unit, how those experiences might impact us. We're going to also show you one video that sort of puts together what might be some of our different experiences. So I need to, I don't see what's happening. Here we go.
As the American public ages, so do lesbian, gay, bisexual, and transgender people. LGBT older adults face the same challenges as other older adults, including financial worries and health concerns. But LGBT older adults face additional challenges. Let's compare two women, Tina and Jackie, who were both born in 1947. In 1967 at college, Tina meets Frank, and Jackie meets Francis. On a date with Francis after work, Jackie is seen by a coworker who tells their boss. Jackie is legally fired and takes a lesser-paying job at a factory. In 1973, Tina marries Frank, but Jackie is unable to marry Francis. In the 80s, Tina and Frank have children, but Jackie and Francis are barred from adopting. After decades of hard work, in 2010, Frank and Francis retire. Tina takes Social Security spousal benefits. But because the federal government didn't recognize same-sex marriages then, Jackie is denied those benefits. In 2015, right before the freedom to marry becomes available nationwide, Frank and Francis die. Tina pays for her in-home care with her Social Security survivor benefits and funds from Frank's pension. Jackie is denied Social Security survivor benefits, and because she was not a legal spouse, is also denied Francis's pension. Their apartment was rented in Francis's name, and her state lacks non-discrimination protections in housing, so Jackie is evicted when she tries to change the lease into her name. Lacking an income and a place to live, Jackie moves into a nursing home and relies on Medicaid to pay for it. She fears discrimination if she shares stories about her past, so she doesn't talk about her life with Francis. Tina can afford in-home nursing care and has the support of her children. After a lifetime of discrimination, LGBT older adults face economic insecurity, poorer health, and reduced support networks. Find out more about the unique disparities facing LGBT older adults and how to remedy them, as well as the strength and resilience of LGBT adults at lgbtmap.org/older adults.
So to bring this section of our presentation.
If you work for an organization that serves older adults or individuals with life-limiting illnesses, the community you serve in
So to sort of bring this section of what we're talking about to a close, the question that I would ask you to think about is, given some of these life experiences, where might that leave us as we age, given the challenges of aging that everybody faces? And here's the thing I want to say. One of the places it leaves us is we are a resilient people. We have come through a number of life experiences and met those challenges, and we have met them in community. We have met them in many ways with forming support groups of other LGBTQ folks. We call them sometimes our chosen family. And so there, for programs like SAGE, where we have a number of social programs, which we say is to increase social interaction, that these become important to us. And that sometimes, if we are in the larger community that is primarily populated by people who are heterosexual, we can sometimes feel isolated even in a group. Now, Sharon is going to present some information, some data, and after that, we're going to ask you all to be in conversation in some small groups.
And I'm back. So we know that talking about statistics and demographics, and again, as I mentioned in the beginning, a lot of these numbers that we're showing have come from SAGE USA and AARP studies and surveys. So we're not going to spend a lot of time about the numbers, but we do want to show these on the screen, and I'm going to talk about some of these things. And then we are going to ask you to discuss in some breakout groups what all of these impacts and what your takeaways are, because we think this will be helpful as we move into the later sessions about what allies can do and what organizations can do. So just an overview to give you some numbers and some thoughts on things. It's estimated that 3 million LGBTQ adults in the US are 65 and older. And that number is expected to double by 2030. And 2030 is getting a lot closer. Again, since one of the major issues of SAGE USA and SAGE Central North Carolina is social isolation, and the pandemic has not helped that. Social isolation among LGBTQ persons is twice as likely to live alone and 3 to 4 times less likely to have children. And again, we want to talk about the current older adults. Some of these numbers, as we move through the next decades, will change because of a lot of the legal issues that Joe has talked about. But the current older adults, that 65 and older that we're talking about today, are experiencing these situations. Health disparities. So again, we in the community have all the same issues that any older adult faces, but again, based on our history and our experiences, we have increased rates of obesity, smoking, high blood pressure, increased rates of breast cancer, and 55% of deaths from HIV and AIDS have been gay or bisexual men. There are significant barriers to care, just like there are for many older adults. But in our community, we are 5 times less likely to access senior services. As we talked about in the beginning, in the history, there's a bias on 2 levels: homophobia and the heterosexism and ageism. And there's a fear of discrimination, neglect, and violence, so we don't seek care.
Oops.
3 of 4 LGBTQ elders is expected to be the caregiver. So again, Joe talked about community, chosen family. And so we know that we are going to be caregivers for those that we love or for those in our community that need someone to be a caregiver. 1 of 5 LGBTQ elders are unsure of who will be their caregiver. So again, they may have lost their partner, they may never have had children, and they may be in a community that is aging and no one is available to assist with their care.
Whoops.
The next few slides, we're just going to ask you to, and we're going to give you time to read them. We're not going to do commentary because this is leading into our breakout sessions. So, and you will have time if you want to take a quick note on some of these things so that you can be discussing these in the breakout sessions. But we are going to go through the next few slides and just let you read those and make any notes to yourself that you would like to do.
Could I sit there? AARP, the previous information came from research that was done by Sage USA. The rest of this information comes from the Managing Dignity Survey that was done by AARP. We'll be giving you a reference for these later if you want to look more deeply into the findings. All right, so we've given you a lot of information and a lot of data. What we're going to do now, and we're going to ask you to turn your video on so people can see your wonderful faces, and come off mute, because Madeline is going to be setting us up. Oh my gosh, it's great to see your faces. Madeline is going to be setting us up in breakout rooms. You're going to have 10 minutes, and we're going to ask you to talk in your breakout rooms about the information we've given you so far. What significance does that have to you as a person, as an individual, as a human being, but also how it informs the work that you do, whatever your area of service is, how does it inform you as you think about providing fully inclusive services? And so here's the truth. Whatever you talk about is fine with us, but we hope that you'll be thinking about how do we mediate some of these challenges that folks have experienced, and what do people bring when they access our services that we need to be aware of? So again, you're going to be in small groups. It's going to be 10 minutes. And I would ask Madeline to set folks up in the breakout rooms.
Joe, I might have accidentally assigned you two. Yeah, Joe, I might have accidentally assigned you as well to a breakout room.
Madeline, I presume that all these folks are assigned and it's just a computer lag to get them into the breakouts?
Yeah, they're all assigned, or they might not like be right at their computer right now.
That could be. Okay. Yeah, that could happen.
And I believe so Heather texted me and said that you didn't have host privileges. So I believe I took the privileges away and then reassigned them.
I see them now. I have breakout rooms. That was when I saw I didn't have breakout rooms, I knew I had been taken out of being host or co-host.
Yeah, when she went to leave, it only gave her the option, I guess, to end the call. So
Yeah. Okay. I need to mute myself. We'll be here if you need us.
okay.
I got it. Hello. Hang on. I got it. I got it. I could hear the whole meeting. I just couldn't, when I went into the breakout, my computer switched something. I'm Lisa Barker, and I work with SHIP in North Carolina, helping seniors and people with disabilities access Medicare and understand their benefits. So I previously worked in just the Northeast region. I've now taken over 7 mountain counties, and we have somebody retiring at the end of February. So I probably will have about half the states as of March 1st. I love it though. I train people like Zach, who I don't know, but I've got his name written down. So I train people out in the community that work with different agencies or volunteers to help people navigate their Medicare and kind of figure it out. And this is definitely a population that's been near and dear to my heart. And so, but trying to safely get in and talk with people about how much money do you have? Are you eligible for Medicare? How can I, and I've worked with seniors since 1998. So I'm one of those people that just takes everybody right where they're at. So when I've gotten into an agency or a situation, once I'm there and invited, it's very well received. And I've been pretty lucky with small groups of people and them coming back again and again. But it's, I think we're missing when Joe was talking about the difference between a hetero person retiring and somebody who is gay or lesbian or anywhere on the spectrum of LGBTQ. The difference to me was like a slap in the face. I have several friends that have retired and are doing okay, but I hadn't thought about it to that extent with not being able to get access to those spousal benefits and things like that.
changing. There's 16 of us throughout the state. We're in Region B, which covers Henderson, Buncombe, Madison, and Transylvania counties. As far as particularly what my job is the Home and Community Care Cooperative funding flows through our company to the service providers in the area, providing services to people aged 60 or older at no cost to them. So adult daycare, transportation, things like that can be offered to older adults, regardless of financial backgrounds or anything like that. Just the only qualification is that they're age 60 or over. I'm funding, make sure that it's getting spent correctly and things like that. As far as my time with Generation Plus, I come from an LGBTQ family. My mother and her wife have been married for almost 20 years now. I got into it because I really want to make sure that at my age and at their age, they are going to get taken care of in the way that they need to be taken care of. So that's kind of my personal campaign, Generation Plus.
So, like I said, I'm a graduate student. I'm getting ready to finish up. I've also been volunteering at our local hospice for 3 years. It's something that, so Julian, I was interested in what you were talking about too. I'm interested now in sort of being able to do a lot of education and outreach to underserved and minority populations to make sure that, because that's who we're not reaching, with a lot of the advanced care planning and the life services, hospice care. So LGBTQ population is one that I'm very interested in reaching out to, the Hispanic community here as well. I do have an internship lined up with Transitions Life Care here in Raleigh, so that's what I'll be doing in the spring. I'm really excited about that. So just trying to get some ideas on, some of the best ways to reach out to the LGBTQ community, help out with that.
One of the things, and this is just community-wide, this is nothing to do with any specific population, but one of the things that I have found has helped with outreach is we partnered, I started volunteering, which then I helped my agency learn how to partner. It's all in how you say it, right? There's a Medicist program out of Charlotte, but they travel the state, and so the way that they are connecting in communities, especially with minority populations, is they give away free over-the-counter medicine. And they go to all 100 counties. And, they really try to rely on the community partners to let everybody in the community know, whether you're, younger family, single person, homeless, a senior, what you're, how you identify yourself to them does not matter. There's no financial. Now, if you are uninsured and need medicine, similar to some of the rural health group stuff, they also have a free pharmacy. So that it's been really interesting when I've been able to go out to those events and talk with people, because I am just somebody handing you a bag of over-the-counter medicine. But as I do that, I say, here's some information. If you or somebody who's on Medicare and they would like somebody to talk to, you can either call me, I'm the regional manager, but you can also call Ship Raleigh, and any of us can help you sort of navigate that. And my background is senior center, so I very much relate to Zach and Julie and definitely what they're saying. So I'm usually an above and beyonder as far as if somebody tells me that they have a question or an experience that they want to share, I'm one of those people that I'm like, okay, here's my card and let's figure it out. So, I think I think it's important to, kind of like what Jackie said, to reach out to all minority populations. And I would say the Hispanic population and the LGBTQIA+ is probably two of the biggest ones that I've had the hardest time finding a consistent in. I've Me llamo es Lisa, poquito español. I have an 8-year-old who's learning Spanish this year, so we play Duolingo every day, and so it's getting a little better. But, so.
Yeah, my Spanish is very shaky, and my concern beyond that is even just as a white woman showing up to offer information.
Hi, Dick. Is everything all right there?
Yes, I think so. I lost my internet service, so I'm back in the meeting, I guess. I'm not sure if I'm in the breakout room, but I'll wait for the meeting to come back. I can't see anybody else. I can hear them.
Yeah, I'm not really sure what's going on. I can hear like one person in a breakout room, and I don't know if they're just like connected from their phone or something. But if you want to be returned to your breakout room, I can do that if you remember anybody that was in it.
A guy named Zach from Asheville, and then one named Julian,
Okay.
and a woman named Lisa from,
Let's see.
it was breakout number 2.
All right. Yeah, I can send you back there.
Okay.
Madeline, how much more time?
I'm sorry, for what?
How much more time in the breakout?
I think they've been in there for about 10-ish minutes, maybe.
Okay, we want it to be about 10 minutes.
Okay, so I can just go. Do you want me to?
Let's do a broadcast message to all that says we'll close in 1 minute.
Okay. All right, everyone should be funneling back in here.
All right. Welcome back, everyone. And I hope you had some great conversations. We're going to want to hear some of the things that you may have talked about, but we promised you we'd have a break about halfway through. See, I believe that the human body is not made to sit for 2 hours in one place. And so I'm going to encourage you, if you can, to stand up, walk around, breathe in some air, and please come back in 5 minutes, because at that point, we're going to have a community conversation. So enjoy yourself, do whatever you need to do. 5 minutes, we'll see you back.
As everyone comes back, if you would turn on your cameras again so that we can see all of you, because we do want to have this discussion. And feel free to unmute if you are going to be sharing with us. You can continue to stay muted if you don't want to participate. But we do want to hear the wonderful conversations that went on in those break rooms. All right, we're back. I hope everybody got a stretch and had an opportunity to move around a little bit, because 2 hours is a long time. So we want to take up to about the next 10 minutes to have some discussion about what those conversations and things happened in the breakout room. Now, we are leaving time at the end for questions and answers, and we do have a couple more pieces of the presentation. So this is strictly to talk about what went on in the break rooms. Is anyone brave and wants to start us off? Now, we heard some good conversations, Jessie.
So I was able to meet with our small group, and as a young professional coming into aging services, it was really helpful to speak to people who have worked professionally with this age group before. I have a passion for older adults, and I want to make sure that I'm able to serve everyone equally and be able to, even though my community is smaller, be able to make sure that everyone feels welcome to seek services. And that's kind of hard when you're coming up in a rural community. So definitely making sure that visibility is key. And when you don't know something, just ask someone who's been in the profession longer than you. So that I have some really good names that I will definitely be contacting after.
Great, wonderful. Someone else?
I'll be the liaison for our small group. We touched on John's comment at the beginning of his presentation when he mentioned how there are communities and it's not, just one community. We touched on that, and then kind of discussed how the tone of all of this advocacy and these conversations is really about respecting people, because they're people and people deserve to be respected. And I don't know, that was just something that really touched me. Yeah, because it's not about like just singling out one particular group. It's about being better and giving better care, because people need it and they deserve it.
Great, thank you. Any of the other groups?
I can share for our group, Sharon. We talked a lot about just acknowledging that the statistics were new information to a lot of us, and that how that impacted us, and how it kind of motivated us to really be more explicitly inclusive in really simple ways to more I guess advanced ways, like trying to create specific queer affirming communities within our work, and we were kind of workshopping how we could do that within all of our different roles. So it was a really great conversation.
Great. Other thoughts?
In our group, we talked a lot about communication and how to reach communities that, are not normally easily reached. As a part of my region, I'm an aging specialist in Region B, which covers Buncombe, Henderson, Madison, and Transylvania counties. We have a group called Generations Plus that was formerly LGBTQ Elder Advocates of Western North Carolina. We got absorbed into Blue Ridge Pride, which is the event here that puts on Pride in the mountains, and being able to be a part of that automatically broadened our horizons and our contact base of who we can reach with, our email blasts and just our, we have socially distant hangouts and things like that. Just safe spaces, creating safe spaces for older LGBTQIA adults who are wanting to engage with the community but may not feel safe enough to leave their homes yet due to COVID.
Great, thank you. I think there's a couple more breakout groups that we haven't heard from. Any takeaways?
In my breakout group, because I am older and about to go on Medicare, and I'm actually looking at all of these things. I talked about what it was like to be aging, looking towards, getting into a community, but how do you find a community where you feel safe? And some of the experiences I've had. We also talked about, as someone else had mentioned, how can organizations show that they are LGBTQ plus affirming, and are there any ways that they can help that particular community? So it was a good discussion.
Great. You guys are setting us up perfectly for our next couple of discussion points before we get to our Q&A. Awesome. Any more discussion? I think we still have maybe one more breakout group we haven't heard from.
I'll take a stab at it. In our group, we talked about being more intentional, intentionally asking, even in our intake processes, and, how do we know, if someone is in the LGBT community unless they self-disclose, and we know sometimes that is not, some people just aren't going to disclose because of fear. So how do we get past that? And how do we get to the point where, it's normalized? This is a normal question we're going to ask everyone who comes through our doors. What's your gender identity? What are your pronouns? Because if we can normalize things, normalize some of those smaller things, I think people will feel in this community a little bit safer to talk about their needs, whatever the needs are, because some are more unique than others. So that's what we talked about a little bit.
Great, thank you. All right, any groups that we have not heard from yet? All right, I think we're ready. So if you want to, we love seeing your faces though. So if you want to leave your cameras on, that would be great. And we are going to go on to the next couple of pieces, but you did an awesome job for us. And this is exactly what we hoped would happen, because you did lead us into our next discussion pieces. So Joe's going to come back and do the piece, and then I will be back in a little while.
Well, it's great to see you again. And I've got to comment on a couple things that I heard. Angela, I appreciate you talking about at intake, asking some of the sexual orientation, gender identity questions. We get that question a lot. Well, how can we talk about that? And my response is, you ask people if they play bingo. You can certainly ask them about their sexual orientation. And I'm not talking about someone that comes in and you think, oh, this person's LGBTQ plus. It's like, it's important to all folks to be able to, the New York Times recently did an insert called Sex After 70. And, it's like, and it's not just about sex, it's about who's our community, who's our support. One of the reasons I got into this work, volunteering for SAGE, is that my husband is 24 years older than I am. He's a World War II vet. And he's been in and out of the rehab system, and he's been in and out of hospitals. And some of the things we've experienced is like 8 years ago, they would see us and they would ask me, "Are you his son?" And then I would say, no, I'm his husband. And we would get this look of, you could see the synapses were just like misfiring. And then we went through a period when it was like, are you his son? And I would say, no, I'm his husband. And they go, oh, great. And then it was like, okay, do you tell straight people it's great that they have a husband or wife? It's like, and now it's just become commonplace. And I don't even see people going through the calculus. When that happens, I know that there's some safety. And so a lot of the groups talked about safety. And I would say that's one of the things, given our experience, anytime we go into a new environment, the way I put it is that our antennae are out. And I think, Susan, you talked about it, that where will I be comfortable? Where will I be, I know I'll be accepted and I won't be in either physical or emotional danger. So I really appreciate these conversations. Now, homophobia and heterosexism, and any area of where a group is subordinated happens at a number of different levels. And today we're going to talk about the interpersonal level, and then we're going to talk about the organizational level. And so I'm going to talk a little bit about the institutional level, excuse me, the interpersonal level. I'm going to talk about how to be an ally. And one of the things that you may remember from the Maintaining Dignity information from AARP is that a lot of LGBTQ folks would like to receive care from other LGBTQ folks, or at least people who have been trained. And so here's what I often tell professional organizations. If you have any out LGBTQ folks, that will make a difference to any LGBTQ person or our families who are thinking about your housing, your service, whatever. And I would also say, if you have 50 employees and you can't identify one that's LGBTQ, the chances are your environment is such that LGBTQ folks are not comfortable coming out. Because you put 50 folks together and we're going to be represented somewhere along that line. And I tell folks in housing communities, even if it's one of the servers that puts people's Jell-O on the table, that makes a difference for us as far as a feeling of safety. So I'm going to talk real briefly about some of the interpersonal things. And we pretty much got through this. You know, we've heard people talk about the gay lifestyle. You know, my gay lifestyle is I cook meals, I wash dishes, I walk the dog. That's my lifestyle. And so if you mean sexual orientation, say sexual orientation, not lifestyle. And I actually had a doctor once say to me, I understand that you've chosen to be gay. And I said, well, I don't think of it as a choice. And he said, I don't want to hear anything about that. And you know what? He never did, because that's the last time I saw him. I have a doctor now that there is a pride flag sticker in their front lobby. And I know that I can talk to my doctor about anything. We also hear people talk about sexual preference. Now, I want you to know, I have a preference for chocolate ice cream. Now, I'll eat vanilla ice cream, but I like chocolate. That's my preference. My sexual orientation goes so much deeper than that. It is part of my identity. It's part of my emotional identity, my spiritual identity. Don't say transgendered. Transgender is an adjective. A transgender person, a trans man, a trans woman, or trans masculine, or trans feminine. And don't say she's a transgender. She is transgender. That is the adjective. Don't use queer unless you are, or you know the other person is comfortable with it. I listen for how people describe themselves. And if someone, like, one of the things that I've heard a lot is people my age don't like the word queer. And I do, I have to say, it's how I think of myself. It's a claiming of, for me. And I'm so pleased that Sage USA for a long time, actually until the last couple months, described themselves as an LGBT organization. And my question was, why don't we add the Q? And they said, because some people were uncomfortable with it. They have recently heard from enough people that says, you are leaving us out if you don't include the Q, that not everyone fits under LGBT. Now, we could also do the whole thing, LGBTQIA2S, etc. That gets a little wordy. That's why we have come down in many places with the plus. And of course, if you ever hear yourself say those people are you people, you know you're already in trouble. We suggest you don't mistakenly out a person as LGBTQ for talking about them and assuming other people know, because we come out in different ways. We may come out to our family. We may not come out to our family. We come out at work. We don't come out at work. When I was 35, I came out at work. I had a great experience. I was working drug treatment at the time. And I remember one of the counselors who worked in my unit said, you know, I said, does anybody have any response? And he said, yeah. He says, I'm really troubled. And I said, why are you troubled? And he said, I'm troubled because we didn't create an environment where you felt like you could come out to us a year ago. Then we got a new director, and let me just say his opinion of folks who are gay was very different than what I had experienced. And I had the experience of being managed out of an organization. And it was the best thing that ever happened for me, because then I got into HIV work and public health and like that. But there can be consequences if people are outed inadvertently. And so just don't ask if people are gay. You know, it's like, unless it's really important, ask yourself why you need to know. Language makes a difference. Is that your husband? Is that your wife? Is a whole different question than what relationship does this person have to you? The person that you're with today, what is your relationship? That can make a big difference. And don't assume someone's sexual orientation. And I'll give you an example. I can identify at least 5 of my close associates in SAGE who are in their 70s, who were married and stayed, men who were married and stayed with their wives until their wives died. And it was important to them that they provided that care. And then they felt more comfortable expressing who they were once they were single. And so how many times do we have people, they talk about their former husband or their former wife, and then we assume heterosexuality based on that was the experience they talked about. And then challenge your conceptions of what's gender appropriate, what roles and behaviors that we know that gender expression in many ways is culturally derived. And so how do we broaden what might be available for people in their expression of who they are? For transgender folks, describe people who transition as transgender as an adjective. If you need to know, ask people what pronoun you prefer. I know many of you in your organizations, you're seeing more and more people add their pronouns to their emails, etc. Now, a couple of years ago at a SAGE event, we were asking people to put their pronouns on their name badge. And there was a woman who was checking in, and she looked at me and she said, well, isn't it obvious? And I said, well, it's pretty obvious as you express yourself, but we put on our pronouns for everyone because for some folks, it's not as obvious. And that can be very awkward for people projecting what our gender identity is based on what we see. If you use the wrong pronoun, in other words, somebody is using they, you know, that rather than use he or she, they use they, and you use the wrong pronoun, apologize and move on. And if you're correct, like if I said so-and-so she, and the person says, yeah, no, I use they pronouns, or even I use he pronouns, then say thank you. Because here's what can happen. I use the wrong pronoun and the other person corrects me and they go, oh, I'm sorry. I am so sorry. I am so sorry. Oh, I'm so sorry. And then it becomes their job to make me feel okay. And that's just an extra burden. But if somebody corrects me, I can say thank you. And then I use the correct pronoun. If you hear LGBTQ jokes or statements expressed in your present, step on it, say something. If you see something, say something. If someone misgenders someone else, it's okay to correct them so that doesn't always land on the individual to whom they're referring. It's just assuming partnership, assuming allyship. Now, with that, that's the interpersonal piece we're going to cover for today. Now, Sharon is going to be talking about some of the institutional and organizational things we can do. And I'm going to encourage you as specifically as you can in the chat, identify any of the things you may have talked about in your small group or things that you have brought to this conversation today, things in your organization that you're doing to create an inclusive space, safe space for LGBTQ folks. Also know that toward the end, as we're doing question and answer, I'm going to be giving you a couple references that we're going to put in the chat, but we'll do that later on. At this point, this is about you're having a conversation with Sharon, and Sharon's going to talk about some of the things our organizations can do. Oh, Heather, were you going to do a poll about an anti-discrimination policy? So we're going to ask you two poll questions, and this is the first one. We're going to ask you to identify what you bring today, what is your position, or how you identify yourself. So if people would fill in the poll.
Can you see that, Joseph?
I can see it.
Okay. And the second one is the one.
Yeah, we'll come to that one, but this is great.
Yes. We've had about 12 people fill it out. We'll give it a few more seconds.
Yeah.
All right.
While we're doing the poll, I will also tell you that we're going to give you our website and our email. And if you're doing aging LGBTQ work, like the folks talked about Buncombe County and the work you're doing out there, we love to collaborate with folks around the state who are doing specifically LGBTQ elder work. So once you have our website and our email, we would love to have you be in touch with us.
Great. So you should see the results of the first question up. Is that?
Yeah, that's great. Oh, hold on. Don't take it away yet, Heather. I just took a photo of it, so we'll have that.
Okay. And I'll move to hopefully to the next question here. Hopefully. Well, there. Oh.
By the way, anytime I'm doing a Zoom, I tell people we accept all animals, all children, and all technology challenges. That's just part of the game.
Okay. Can you see that second question there? So the yes and no, we've got 74%.
I don't see the second one, but that's okay, as long as you do.
Well, I'll read them then. So the question was, my organization's anti-discrimination policy covers sexual orientation and gender identity as a protected class. 74% said yes, 5% said no, and 21% said, I don't know.
Great. Thank you so much. We appreciate that. Thank you so much, Heather, for putting that up there. So I am monitoring the chat at this point. Thank you for typing in. And what I want to talk about now is some things, as Heather shared at the beginning, my background has been working with organizations and agencies, not-for-profits and for-profits for over 30 years. And I've worked I started out in an acute care setting in a community hospital in Ohio, and have ended up with a world-class employee assistance program doing clinical management. And now for the last almost 7 years have been doing my own geriatric care management business. So I've been on all sides of creating policy and procedures and railing against policies and procedures for my clients. So what I want to talk about now is some basic information of how to, as an organization or a group, start some steps that can be helpful. And I'm really excited, Susan. That's great that you have the trainings and the in-services, because SAGE is very much committed to starting conversations with trainings and education. We believe strongly nationally and here in North Carolina that that's how things really change. So one way, and I'm going to share just a couple of personal stories that I've had here in the last couple of years. And one thing Joe referenced in his personal story is that when we start advocating for ourselves as older adults, we start asking questions about whether it's home care or whether it's continuing care retirement communities or even independent senior living is, do the people look like us? And I don't necessarily mean physically, but do we have shared experiences? As we age, we want to be with folks that, as Joe unseriously said, we all like to play bingo. Do we have shared experiences that we're going to be able, do we have shared likes that we're going to be able to enjoy? And so I think when we go into institutions that supposedly are senior friendly, and we ask questions about how many LGBTQ staff do you have? How many LGBTQ participants or residents do you have? And as Joe said, most of the time it's reacted to with a frozen smile and the politically correct, oh, we're very open and affirming. And they sit there and smile at me. And I say, well, what does that really mean? Well, we don't know anybody on our staff that is out. And as Joe just said a little while ago, that is a concern to me, because that means that somehow the environment is not conducive to someone being out as an employee. And so when you see places that, as Susan mentioned, are showing the LGBTQ flag, the pride flag, you have employees that are very obviously proud and talking about their LGBTQ, then you know you have an environment, at least in the employee workforce area, that is comfortable with that. Now, that may be a whole nother area as compared to your fellow participants or residents. As Joe talked about, the whole history of this is that many people in these generations that came through all of this didn't talk about it. We came out of an era of don't ask, don't tell, don't talk about it. So you didn't ask about it, you didn't talk about it. So the peer group may not be as comfortable with that. It may not be that they are against it, that they are actually going to be homophobic. It's just that it may not be an experience that they've actually shared before. So we have done trainings and discussion groups with residents at continuing care communities. And it's great to be able to have safe environments that you can have these discussions and that questions can be asked and experiences can be shared on all sides. So I think there's a lot of things that senior centers can do. I think there's a lot of things that independent senior communities can do. But when we talk about, when we get to personal care, when we talk about home care services, inpatient services for rehab, skilled nursing facilities, hospitals, that's a whole different level, because you are talking about having assessments done, clinical assessments, asking questions, those dreaded intake forms. And SAGE Central North Carolina has even been in conversation with the state of North Carolina about changing the Medicaid forms and all of the intake forms so that we can ask these questions of all people. Everyone is going to get the same questions, so that the setup is not for failure, the setup is for success, that you can ask questions. So asking the non-gender conforming questions of everyone. And yes, we know initially some people will be confused, like the lady that came to the SAGE gathering and wanted to know why she needed her pronoun. But that's okay. We can clarify that with those folks. We want to ask questions about, because really what organizations want is, who is the support for these individuals? What is going on? So we want to get to those answers, and we want everybody to feel comfortable. So instead of asking initially, who's your legal decision maker, or whose insurance is going to be paying for this, how about questions about who's with you today? Who is your support person? So that we can talk about who family is, because we all know that in dealing with older adults, the decision maker may be someone that's not even in state. They may be a power of attorney that's in New Hampshire. But in reality, the support person is the person that lives next door to them, or in the apartment next to them, or is their partner of 35 years, and they have just not chosen now to become legally married for a whole variety of reasons. We have a lot of people in SAGE that are in a whole village is supporting people. We have a lot of older adults that don't have a primary caregiver. So we in SAGE are doing a whole bunch of caregiving. So we may have some people that help with meals. We may have somebody else that helps with transportation. So in reality, that individual has 7 caregivers that are all very invested in this individual's well-being. So we believe that there are a lot of opportunities for changing how organizations demonstrate their affirmation of communities. We do believe that visible displays, the Pride flag, SAGE USA, and we'll include information in this, offers training at a national level to become SAGE USA certified and levels of care for your employees. There are a whole host of ways to do that. And that goes back to training whoever's doing your initial intakes and assessments, looking at your forms, having somebody look at your forms and say, do these make sense? Is there anything on here that doesn't make sense? So at this point, I would like to ask you we've been seeing some great things here in the chat. I hope everybody's looking at it because there's some great resources for people. But if you have any questions, or you're welcome to unmute and ask them. Joe is still here in the room with me, so he can weigh in as well. But we would like to take some time to answer questions or have you share some things that have been very successful to you.
Can I come into the resources?
Yes.
We noticed that some people were going off, and we want to give you the resources. So I'm going to put them in the chat pretty quickly, but I can do that while we're having a conversation. So who has a question, either to put in the chat or to just come off mute and ask us? Bueller, anyone?
Joseph, I'll just chime in because I think one of my aha moments very early on in working with Sage, probably 10 years ago, it was a conversation around the nationally funded Family Caregiver Support Program. And it was Les Geller who he really, just opened my eyes and said, that program, it's called the Family Caregiver Program. And so there, when you guys had conversations about social supports and chosen family, and that program doesn't have any eligibility around blood family at all. It's a very open definition of family support and providing caregiver support. And so to me, just one of the nuances in things that we talk about every day and don't even think about it, like the National Family Caregiver Support Program for folks, could sound very exclusive when in fact the eligibility is not. And so I just really appreciate your comments around family, chosen family support systems, and asking those questions. So thank you.
Thank you, Heather. Yes, and the national, the Older Americans Act now identifies LGBTQ folks as a population at highest risk. So we know that our area agencies on aging have, many of them have begun to focus on the needs of LGBTQ folks in their geographical area. So others, what questions do you have? What question, if you don't ask it, you'll feel sorry later that you didn't ask it in this group? And if you want to remain anonymous, just send it to Sharon and me, and we'll relate the question and answer it.
I'll ask one. So you talked about additional training that the Sage USA provides. Is there local training that we could have as a starting point for our staff or board members that we could expand this conversation more in depth in our organizations?
Do you want to answer that? Do you want me to answer?
Go ahead.
Okay. Thank you, Heather. So first of all, Sage has a great relationship with the Dementia Alliance. We put together a team at their fundraising walk, and we were the #2 fundraising team. And we enjoy when we have partnerships. The kind of training we're doing today is similar to the kind of training that we can do. And here's our standard. We do have a cost unless we have a close relationship with the organization. If we have a close mutual relationship with the organization, we provide this training free of charge, whatever we do. We did a training last year with a CCRC where we did 4 1.5-hour programs. So a total of 6 hours that they made available to their staff and to their residents. So that is the local training, and it looks a lot like what we did today. The Sage USA training is a certification training, and your organization actually could get a level of certification that you could then claim and make public, that if people were considering having a relative or friend or themselves in your facility. So, and I'm going to use this, Heather, given your question, as a chance to say, I know there are other folks in here, on here, who come from other areas who are doing LGBTQ aging work. So I would say wherever you are, reach out into your community and find out who's doing the work. You know, SAGE is the only organization I know of in our area throughout central North Carolina that deals specifically with aging LGBTQ issues. Some organizations do aging work, some do LGBTQ work of all ages, but find out who's doing any work in your area and, you know, just go to the internet and start your research.
Joe, one thing I wanted to ask is there a list anywhere of aging communities or aging agencies that have been trained that LGBTQ people would feel safe in, or that are specifically geared towards LGBTQ people?
You want to connect that? You want me to?
So thanks, Susan. Yes, SAGE USA does have a list of the folks that have gone through their trainings and their certifications, and that is available. And there are organizations in North Carolina that have gone through that. So that, yes, that is certainly something that's available. As far as the trainings that we have done, we certainly, and again, just being totally transparent and honest, lots of organizations have started these processes over the last 4 or 5 years. Because for SAGE Central North Carolina, I am the education and training coordinator. But unfortunately, and what we're talking about here for organizations is a systemic change, is that what we have seen is when an executive director leaves or some key staff leave, then the organization's commitment to that training and everything leaves with them. So we have some advocacy pieces that we feel very strongly about here in SAGE Central North Carolina of there's a difference between having offered a training and for that entity to be truly welcoming and safe for our community. And one piece that I feel strongly about, especially here in the central area, is that when folks contact me, I do a current status check of that organization to see what is actually happening. And this is true. We all know this from working in the older adults field. We have to constantly check because staffing changes and things can look very different from 6 months ago at an organization or an institution. So I hope that helps, Susan. Yes, there are some things, and the ones that have the certification, that's an ongoing, they have to keep that up. So there is a level of commitment to that component. Yep.
Is there a list that is out there, or because it changes so often, a list is not something you can provide?
I think the answer, Susan, is that there is not a universal list, either that we maintain in the state or that SAGE USA has available. You can contact, like for example, we've had more than one person contact SAGE Central North Carolina to ask about hospice services. And do we know a hospice that is affirming and welcoming? And the great news is that we have relationships with a number of the hospices, and we can provide them alternatives. When we're asked, do we know of long-term care facilities that are affirming and welcoming, the list is a lot shorter. I also want to respond to Scott's question. It's actually one of my favorite questions. How do I get involved and volunteer with SAGE? Well, here's the deal. SAGE Central North Carolina is an all volunteer organization. And So we're always looking for volunteers, and people get involved in advocacy, they get involved in education, they get involved in helping us. Like we're having a reception on the 25th of February at what will be our new location at 4 North Blunt Street in Raleigh. It's from 4 to 7. And we're going to put together a team of 20 volunteers to set up the room and take down the room and that kind of stuff. So we for a number of years, and we're going to be doing it again because we're now Meals on Wheels has started doing its regular deliveries again. We host a team of SAGE volunteers who deliver Meals on Wheels in Raleigh. And so that's a way that people get involved, is join the SAGE team for Meals on Wheels. So there are lots of opportunities. People ask us if we're a membership organization. The answer is yes. And we have a very rigorous membership policy. If you give us your email address, you're a member. So if you're interested in it, and I put my personal email and our website information in the chat. If you're interested in volunteering, you let us know. And if you want to be put to work, we will put you to work. Let's see. If someone has a copy of the New York Times article, is that the one, I presume, the one about sex after 70? I don't have a link for that handy, but we can, Heather's going to be sending out some information after the program, and we will make sure that that link with the New York Times is part of it. Let's see if there's any other questions. Nope, a lot of people have other appointments, but thanks for telling us you got a busy day. We've got time for maybe one more question. Anybody? Anybody?
I just wanted to make sure I went on, I think I went to the right website. Yeah, sageusa.org. And there's a get involved section and where you can put in your email address. And I just want to make sure that that's where you go to.
If you want to get involved with us, go to our website, which is sagecentralnc.org.
Okay, cool.
Yeah.
All right. Thank you.
Yeah. But I will tell you that the links we gave you for Sage USA and the National Clearinghouse, they have a library of information available about LGBTQ aging, and you can certainly avail yourself of that. Okay, why don't you close us out?
Well, Joe, let me come back to say goodbye. So we really appreciate this time and that you all spent the morning with us, and we hope this information was helpful. We are very happy to partner with you all. And Heather, thank you so much for scheduling this and getting the word out. This has been a phenomenal opportunity for us. Thank you so much.
Well, I want to say thank you, Sharon and Joe. Just incredible amount of information, and I appreciate not only your membership, but your dedication and your willingness to do this. I think it's just such an important topic, and we could go deeper, dive deeper and deeper and do like a 6-series session on this. But I think this was a great start, and I just appreciate your time and willingness to do this, as well as the co-chairs from our Health Equity Committee, Dara Fulmer and Laura Slabach, who really pushed this and made sure we got it done. And we wanted to do it on Valentine's Day, but the day didn't work. So we wanted to show Sage our love. There's Laura with her camera on, and we'll be doing much more health equity work in the future. So I just think that this was a great kickoff. And pleased for all the participants know that Sage is willing to do presentations like this for other groups. Their training committee is phenomenal, and they will just center it to wherever you need it. And we really appreciated that today. So thank you all for being here and your own dedication for health equity and inclusion initiatives, and no matter where you're working. So I'll look forward to sending everybody an email with more of these resources later, but thank you for being here with us today.
Bye.
All right. Good morning, everybody. Welcome. Welcome. We're going to get started in a few minutes. We're letting everybody get admitted and logged on.